Blepharitis. Blepharitis is a chronic inflammatory condition of the eyelid margins, usually involving the area where eyelashes grow. It is commonly bilateral and tends to have a relapsing course. Inflammation of the eyelid margins in the case of blepharitis can lead to severe swelling and irritation, and even sometimes mild swelling and irritation. So now let's have a look what are the different signs and symptoms of blepharitis. One of the most common symptom of the blepharitis is eyelid irritation. Crusting, dandruff-like flakes or scales will be present on the eyelashes, you can see here. Also, itchy eyes is one of the most common symptoms of the blepharitis. Patient will feel irritation, itching, burning sensation in the case of blepharitis. Light sensitivity is also present and loss of lashes in some ulcerative blepharitis or severe chronic blepharitis. Blepharitis, crusted eyelashes or eyelids that stick together when you will wake up is also present. That's how it looks like. And now let's have a look on what are the causes of the blepharitis. One of the most common cause of blepharitis is bacteria, Staphylococcus species. The species of Staphylococcus aureus, and Staphylococcus epidermidis are present normally on our skin. They normally live on our skin and eyelids all the time without causing any kind of disease. But under certain conditions, these bacteria overgrow and produce toxins that irritate the eyelid margins. This can happen especially in the case of poor eyelid hygiene. The second cause is seborrheic dermatitis. Seborrheic dermatitis is a skin condition that causes flaky skin and excessive oil production, creating a favorable environment for the bacterial growth on scalp and eyelids. When there will be the presence of dandruff on our scalp and eyebrows, there are more chances to get blepharitis. Poor eyelid hygiene is also one of the most common cause to blepharitis among all these conditions. In a case of poor eyelid hygiene, there are chances that person is not washing his hair for a long duration of time, and it can lead to dandruff. And when there will be the dandruff present on your scalp, there are much chances that you can get blepharitis. Meibomian gland dysfunction. Meibomian gland is a special oil producing gland which is present in our eyelid. Its job is to produce oil and to mix it with our tears so our tears will not evaporate too quickly. But in the case of this meibomian gland blockage, our tears will evaporate more quickly, our eyes might become dry, and yeah, there will be more chances of bacterial growth which can lead to blepharitis. Mites, Demodex mites. Demodex mites are the mites that normally live on our eyelashes. But when there will be poor eyelid hygiene, these mites can grow and can lead to very severe blepharitis. Seasonal allergies or makeup or skincare products can trigger an allergic reaction, and that can lead to inflammation in the eyelid and it can lead to blepharitis. Contact irritation includes the any kind of chemical, smoke or dust that can cause irritation or inflammation on the eyelid margins. The person will be more likely to get blepharitis. So these are one of the most common causes of blepharitis. Now let's have a look on types of blepharitis. There are two types of blepharitis: squamous blepharitis and ulcerative blepharitis. Squamous blepharitis. Squamous blepharitis is mostly associated with the skin condition seborrheic dermatitis, dandruff on scalp, which we have already discussed. Abnormal metabolism can also lead to squamous blepharitis. In squamous blepharitis, white colored small scales on eyelashes will be present that will appear like a dandruff on the eyelashes. On the removal of scales, the skin will be hyperemic. There will be no bleeding at all. In a case of squamous blepharitis, it means that it's not ulcerated. Ulcerative blepharitis. Have a look on this. This is squamous blepharitis. It looks like dandruff on eyelashes. In the case of ulcerative blepharitis, when we will remove this blepharitis, there will be bleeding and it will be very painful. So this is how you can differentiate between squamous blepharitis and ulcerative blepharitis. In squamous blepharitis, there will be no bleeding when you will remove this crusting, but on the other hand, in ulcerative, it will be very painful and there will be bleeding on removing this ulcer. Ulcerative blepharitis is caused by the bacteria Staphylococcus. Yellow crust or dry brittle scales glue the eyelashes together. On the crust removal, small ulcer seen on the base of eyelashes. Okay, let's move on to the treatment. For the local treatment of this blepharitis, warm compresses are recommended. Warm compresses helps to loosen the scales or crusting, and this will help to easily remove this crusting from the eyelid margins. Bathing the lid margins with 1:4 baby shampoo or 3% bicarbonate lotion is recommended. In the case of any exposure to bacteria, broad spectrum antibiotics and eye ointments are recommended. For the general treatment of blepharitis, improvement for general health is recommended. Personal hygiene is one of the most important part. Dandruff of scalp should be treated, especially the seborrheic dermatitis should be treated. Yeah, so that was the treatment and management for blepharitis. That's all for this video.